Good morning, everyone. The purpose of this briefing this morning is just to inform the citizens of Bossier City and the parish of what we're doing in response to the pandemic event that we've been experiencing here for a couple of months, what we've been doing as a city and the parish, and what we will continue to do. As of April the 22nd, yesterday, the parish is at 246 positive cases and with 12 deaths of parish citizens. We're still having our so-called non-essential employees work from home where it's feasible and needed. Our police and fire departments are essentially continuing to run at full staff, and I will now ask our two public safety chiefs to make remarks. So, Chief Zagone, if you start us off.
Yes, sir. Like last week, first off, I'd like to start off by saying thank you to the Bossier City Fire Department, the Police Department, the frontline employees, and the healthcare workers. I did a 30-day run volume. Last week we gave a 2-week run volume. We had 901 calls, 474 transports, 86 of them had symptoms. The positive we know of were 22, and the positive plus the potential positive or patients with symptoms were 77 of the transports. We are still procuring PPE. We had a delivery of some N95 masks last week. We have more coming, more thermometers, stuff like that, gowns. We're still sitting in a very good shape right now. We are we're learning from this every time. We learn from Ebola. We're learning from this how to do things better in case we see something again, or even to know that this is the beginning and we know there's a winter behind it, that we may see these patients again, and also, but we want to be prepared for that and we try to stay ahead of it. We're prepping for just in case there's a reopening of the city. We're putting a sneeze glass in front of all counters so that when people come up, the public comes up to, just like you're seeing at the Circle K's and all that. We're doing that here at the city. We got the 6-foot tape markings for the floors. We're going to measure out, and we'll be taking precautions to make sure people are 6 foot away, and the travel pass as to which way people come and which way we go, to keep people from being all gathered up in one area. We're just trying to be proactive and stay ahead of this deal. The other thing, since I'm the show and tell guy, I brought, this time instead of equipment, I actually brought our assistant medical director, Dr. Bryant Boyd. He's an ER doctor at Willis Knight and Bossier, and now I'm going to switch seats and allow him to give you an update of what the hospitals are seeing and possibly give you some good information on that end.
Welcome, Dr. Boyd.
Thank you, sir. Thank you, Brad. So one thing I was going to talk about is how the different hospital systems are changing kind of how we're treating this disease and everything. So one thing that we implemented yesterday at the Willis Knighton system was any COVID patient that's positive, we are sending to Willis Knighton North. That's going to be the COVID hospital. So that should ease some fears about the Bossier citizens about going to Willis Knighton. I know Shumpert's doing the same thing. If you go to the Shumpert-Bossier location, they're shipping those patients to Highland as well. So if you're going to one of those hospitals or one of your loved ones is upstairs, that should ease a lot of fears that there's not a lot of other patients around that can, co-infect them or things like that. So that's one thing we're kind of excited about. Now, another thing I wanted to touch on is if you are having symptoms, you can still come to us for us to test you, because most of the tests we are seeing are, have been negative, fortunately, but we can still do the 45-minute test if you're real sick to be admitted, but if you're just not that sick, you can still go to your family doctor and get tested. That test still is taking a few days to come back. Another thing we wanted to touch on was if you're having some symptoms of anything, you fall and hit your head, you're having chest pain, you're having abdominal pain, if it's bad enough that you're worried about it, you can still go to the emergency department. It is safe. Our emergency departments are separated. They're partitioned off for a COVID side and a non-COVID side. So if you fall and hit your head, you're going to be not even taken through the real waiting room, going straight to the clean side. so we can, get a CAT scanner to do our physical exam to treat you the way we need to be treated, because we're seeing a lot of delayed presentations of people that we could save had they presented in a timely manner. So when they come 2 days late, it kind of puts us in a hard position that I know I could have done something to save them, but they were scared of COVID, so they waited 2 days before they presented. So it's just kind of put us in a hard place. So hopefully that'll ease some fears. If you're having a true emergency, please still come so we can get evaluated. But the new protocols are in place for any COVID positive patient. They're all bringing to Wilson Knighton North or Highland now. So the Bossier hospitals are good and until then, if or when the next wave hits next fall and winter. So.
Well, that's excellent information. Chief, anything to add?
No, sir.
Well, we're very fortunate to have persons like Dr. Boyd and their medical system and first responders here in this parish and other parishes. They're doing a great job, and we really appreciate you very much. Chief McWilliams, give us a little update from your area.
Yes, sir. I would also like to thank the first responders and the medical community for being on the front line and doing the jobs that they do, coming to work every day knowing that they could possibly be exposed. We appreciate the hard work that they've all done. I'd also like to thank the citizens of Bossier and the business owners in Bossier. They have done a tremendous job at doing what the governor's orders have asked. We haven't had any major issues with any businesses or any civilians as far as having to do any type of enforcement. So we really do appreciate that, and we ask you to continue to do your due diligence in that. At the same time, we'd also like you to maintain using our non-emergency number, the 741-8605, if you need to try to get in touch with investigators, or if you need to obtain incident reports or accident reports. Accident reports, like I said last week, can be obtained online. Incident reports can be obtained by calling that non-emergency number and asking for the records division. Just ask everybody to continue to work with us, and hopefully the first of next week we'll have some new orders from the governor and we'll be able to press on with this fight.
Chief, as you mentioned last week at our briefing, scams are of real concern, and if anybody's experiencing them, what do you suggest they do? Who they contact?
They should contact our non-emergency number, and they'll go into our communications, and we'll either dispatch an officer to where they are to make a report, or if we can take the report over the phone to avoid any person-to-person contact, we'll take that over the phone. It'll be forwarded to our White Collar Crimes Investigations Task Force, and it'll be followed up on at that point.
Good. Anything else, Chief?
No, sir.
Thanks, Chiefs. And also, anybody who would like more information on what's going on in the city about our response, you can contact our website, which is bossiercity.org, and get a great deal more detail on these things. I and others continue to have almost daily coordination with many individuals within the parish as we collectively work this problem. We've got elected, appointed officials, medical, military, Homeland Security, FEMA, and other agencies, and certainly our public safety officials involved. And we're just doing a really effective job of having everybody discuss the problem and being on the same page and addressing this problem. Excellent teamwork. The current focus, I think the hot topic is this one right here, guidelines for opening up America again. The president and his staff put that out about a week ago, and it's just what the title says, it's guidelines. The federal government is coming up with a series of recommendations that would have the nation go into a recovery from this situation on a state-by-state basis. The federal government and Center for Disease Control and FEMA and others would continue to make recommendations, and the president and his staff will continue to send this out to the states, but the intent is that the states will implement their own recovery program consistent with the guidelines in this document. And there's certain things that have to be prerequisites before we can go into the 3 phases of operations. Such things as the concept is it's the locally executed, which is us, and then it's the state managed, which of course is the governor and his staff, and then federal oversight and support, and that of course is what these guidelines assist us in doing. The intent of this is that as I've alluded to already, is that the recovery will be managed state by state, consistent with these guidelines and core values, and it's contingent on certain things happening prior to starting the phases. For example, there's got to be, over a period of time, a 14 days, a reduction in the trajectory of the number of positive episodes and individuals with flu, and all those things have to be going down over a 14-day period, those sorts of prerequisites. So there are requirements for, and extremely important that we get more tests, more accurate tests, and that'll give us the data that we will need to come up with models so that better decisions could be made. So I think it's a good guideline. Governor has started a commission to assist him and make a decision, and our two legislative bodies, the legislatures and the senators, they've come up with a joint task force. It's a rather large group, but both entities are working together to help the state come up with the best approach to go into this in a phased operation. As I understand it, the governor would prefer once, and by the way, the clock's ticking, his current proclamation expires on the 30th of April, so we would anticipate, as was mentioned earlier, that we'll get more directives from the governor not later than the 30th of April. But my understanding is that the governor prefers doing it on a guidance from his level statewide, where some of the legislators would prefer doing it parish by parish. So they're going to have to work that out. But in any event, we'll be getting our guidance from the governor as coordinated with the legislators there. The governor's group goes by the title Resilient Louisiana. That's the title of his group. And the group that's formed by the Senate and the House is Louisiana Economic Recovery Task Force. So those are the two groups that will be working with the governor and his staff to give us the directives and guidance we will need locally to implement it. I feel that the citizens of Bossier City and Bossier Parish are extremely fortunate that we've been proactive and known this from the very get-go. And look, we learn from each episode. We hear that it is anticipated that this fall will be the first time where we're still dealing with COVID-19, but we're in the regular flu seasons. So the incidents might very well increase just as a function of we're in the flu seasons this time. At the same time, we're still working COVID things. So that, again, remains to be seen. But since there's some similarities in the symptoms and so on, that's going to be an added challenge to our medical force and others. In closing, I would just ask all the citizens to stay the course. It's important that each one of us do our individual responsibility, even as we go through these three phases, that we continue to do those things that we've been told to do from the get-go with regard to personal hygiene, size of crowds we can be in, people that are most likely to be have more serious results from having a positive result, but all of us individually have a responsibility to do these things if we're going to come out of this thing in any reasonable length of time. Just as a side note, I heard the governor's being quoted this morning emphasizing the wearing of masks, and it's recommended essentially everybody do it outside, but the governor is not recommending gloves for individuals. It is being recommended for people who work the cash registers and that sort of thing. But the governor was suggesting that gloves are just a part of the problem, and he is suggesting we individual citizens not wear them, but highly recommend to wear a mask anytime we're outside. So, a little additional information. There was a press release put out yesterday, and many of us in this room are aware of it, but perhaps our citizens don't. The Barksdale Air Force Base is going to have a B-52 flyover this coming Friday. It'll start at 3 o'clock over in the Monroe area, then it'll fly over here and be in our area at about 3:30. I think it'll be one B-52, but the flight path will be to try to fly over the medical facilities. And the whole intent of this show of support to the medical community and first responders for what outstanding job they have done, and many, many times to their own detriment, taking care of somebody else. So they are well, this recognition is well deserved. And in closing, I want to thank all the citizens for doing what you've done since it was first asked of you, is to comply with these social distancing and wearing a mask and all those other things that can help each one of us save a life, and that life could be our own. Anything, last minute thoughts, anybody?
No, sir.
If not, thank you. Good day and good day.